नमस्ते ब्लॉग में स्वागत है।
नमस्ते, स्वागत छ सर हजुरलाई। कामको व्यस्तता यस्तो धेरै भयो हजुरलाई, हाम्रो टाइम दिनै पाउनु भएन होइन। कति महिना अगाडि हामीले चाहिँ यो सुरु गर्ने भनेको थियौँ। अहिलेसम्म
3 मंथ हो गए।
3 महिना भइसक्यो। 3 महिनामा हामीले 1 घन्टा टाइम पनि नपाएकै हो त।
मुझे 5 महीने हो गए।
हजुरलाई सोध्न मन लागेको कुराहरू चाहिँ मसँग टन्नै छ होइन। जस्तै क्रायोप्रिजर्भेसनको कुराहरू चाहिँ छ, जो चाहिँ नर्मल्ली मान्छेहरूले फ्रिजिङ भनेर चाहिँ बुझिराखेको छ। यो फ्रिजिङ या क्रायोप्रिजर्भेसनको डेफिनेसन डिफ्रेन्ट तरिकाले हुन्छ कि फेरि एउटै नै हो या
एउटा नै हो? दिस इज द सेम फ्रिजिङ और समटाइम्स साइंटिफिकली वी कॉल इट क्रायोप्रिजर्वेशन। क्रायोप्रिजर्वेशन बेसिकली क्रायो मीन्स that we are freezing anything in a very low temperature, in a minus temperature. That's we call it cryo. In mostly the cryopreservation done by using liquid nitrogen, or we basically used to say freezing also. We can also say that it's a freezing, normally sperm freezing, but basically it's all cryopreservation. Embryo freezing, whether it's a embryo freezing, oocyte freezing, sperm freezing, and ovarian tissue freezing. That's all done in a nitrogen, and we call it
testicular tissue पनि
everything
भन्नाले हाम्रो सहारा भित्र चाहिँ अन्त त क्रायोप्रिजर्भेसन अनेक चीजको हुन्छ होला हैन। इभन कुराहरु पनि
लाइक सिंगल सेल्स, बेसिकली द सिंगल सेल्स वी क्यान फ्रीज।
तर आज हामी चाहिँ सहारा इन्टरनेसनल फर्टिलिटी सेन्टरले गर्ने क्रायोप्रिजर्भेसनहरुको बारेमा मात्र कुरा गर्दै छौं। त्यहाँनेर अरु कुराहरु त हामीलाई पनि थाहा छैन हैन। तर यसमा चाहिँ स्पर्मको क्रायोप्रिजर्भेसन हुने रहेछ। अनि अर्को भनेको एग, अब फिमेलको एगको चाहिँ क्रायोप्रिजर्भेसन हुँदो रहेछ। अनि टेस्टिकुलर टिस्यु जसलाई चाहिँ टिसा गर्न पर्ने त्यो तिनीहरुको चाहिँ हुने रहेछ। अनि त्यस पछाडी एम्ब्रियो जब चाहिँ बच्चा बनाइसके पछाडीको त्यसको चाहिँ हुँदो रहेछ। अनि अर्को भनेको ओभरियन टिस्युज। अब यो सबै चिजले चाहिँ हाम्रो आइभीएफ को प्रोसेसलाई चाहिँ पहिलाको भन्दा पहिला जब चाहिँ क्रायोप्रिजर्भेसनको कुनै पनि सिस्टम नै थिएन होला नि सुरुमा, त्यो कसरी चाहिँ बिल्डअप हुँदै आएको थियो?
द सिस्टम वाज देयर, क्रायोप्रिजर्भेसन वाज देयर, बट द टेक्निक वाज डिफरेंट. And before, I think 1 decade before, it was slow freezing. Now we are doing vitrification. Vitrifications, the process is called instantly freezing the embryos. Like it took only 8 to 15 minutes to freeze embryos or oocytes, or even that's ovarian tissues. But few years ago, it was slow freezing. It took about 4 hours, near about, to freeze embryos. 3 to 4 hours.
And 4 hours सम्म त्यो चाहिँ खासमा डेड हुँदैन फेरि?
Dead, there were higher chances that we will not retrieve full 100% because of the slow fission. There was a very high chances the ice crystal formation. What basically we do, we protect the formation of ice.
हाम्रोमा एउटा कुरा के थियो भने, नट जस्ट पेशेन्ट, मेरो आफ्नै कुरा पनि, मलाई आफूलाई पनि कस्तो चाहिँ लाग्थ्यो भने, यो फ्रिजरमा राखिसके पछाडि या मानव क्रायोप्रिजर्भेसनमा राखिसके पछाडिको त्यो जुन क्वालिटी डिग्रेड हुन्छ होला हैन। अब एकचोटि एउटा स्पर्मलाई त्यो स्टेटमा चाहिँ राखेर फेरि त्यसलाई चाहिँ एउटा हिसाबले त्यसलाई चाहिँ के भन्छ, फ्रिज गरिसके पछाडि फेरि त्यसलाई चाहिँ रिबर्थ गरेको जस्तो या चाहिँ फेरि जन्माएको जस्तो,
ब्याक टु बेसिक नर्मल।
अन्त नि त्यो भन्न खोजेको, अब जस्तै फ्रिज भइसके पछाडि त त्यो चिज त फेरि चलायमान त हुँदैन नि त। यो काइन्ड अफ त्यो त मुभेबल त हुँदैन नि त। केही पनि चिजलाई फ्रिज गरियो भने हाम्रो आँखाले देखेको चिजहरू त त्यस्तै नै छ। तर त्यो माइक्रो अर्ग्यानिजमलाई चाहिँ तपाईँहरूले जुन फ्रिज गरेर या क्रायोप्रिजर्भेसनमा राख्नुहुन्छ, त्यो चिज चाहिँ फेरि आएर चाहिँ भाइबल कसरी हुन्छ, त्यसलाई कसरी त्यो चाहिँ रमाइलो।
How it is happening? Basically, I will tell you. Let me tell you. We use a different solution.
के हामीले चाहिँ डेड सेल्स नै युज गर्ने त होइन नि?
होइन, the cells should be live. अगर लाइव होंगे then we only will able to retrieve the live cells. if we are freezing a dead cell, so how we can retrieve the life?
हाम्रो मेरो बुझाइमा कस्तो थियो भने जस्ट डेड सेल्स नै हुन्छ होला, त्यसको एनर्जी युज गर्न गर्छ होला, केही त्यसमा युज भएको चिजहरू केही चाहिँ काम लाग्छ होला, त्यसलाई चाहिँ फर्टिलाइजेसनमा चाहिँ युज गर्छ होला।
It should be live. Then we were able to retrieve it fully. Now
भन्नाको मतलब त्यो चाहिँ एकपटक फ्रिज भएर फेरि ऊ चाहिँ फेरि लाइभ हुन्छ होइन?
We are just there is a term use करते हैं, we term use the hibernation. You know the hibernation.
के हो?
Basically the lizards, frogs, they hibernate for 5 to 6 months. They slow their metabolism.
Oh.
To just to.
मैले सुनेछु यो
that's polar bear and all kind of things. They hibernate.
Yes.
They for 4-5 months they eat a lot food. They just gain a lot of fat. And during hibernation they use that fat. They don't eat, they just sleep. And
so
this
nature को मैले सुनेको है फेरि अर्को चाहिँ यो क्रायोप्रिजर्भेसन चाहिँ लगभग 9-10 वर्षसम्म पनि भनौँ न, अब कति बेलासम्म चाहिँ राख्न मन छ त्यो लङ टाइमसम्म राख्न सकिन्छ भन्ने छ नि त। तर यो नेचरको उसमा चाहिँ नेचुरल वाइज चाहिँ त्यो 6 महिना म्याक्सिमम होइन,
maximum 1 year 2 year. Recently the case have been done in the UK. They thought I think after 28 year 29 year they thought the embryos they transfer and they got the parents got a child from that
20 years
28
सम्म चाहिँ फ्रिज गरेर राखेको स्पर्मलाई युज गरेर पनि
हैन embryos they use
embryo
directly embryos.
ल ओके,
so we can extend up to 50 year I think normally 50
हामीले हाम्रो अडियन्सहरूलाई चाहिँ आज स्पर्म भनेकै के हो, अनि त्यस पछाडि एग भनेकै के हो, अनि त्यस पछाडि अरू यी चिजहरूलाई चाहिँ फ्रिज कसरी गरिन्छ, अनि त्यस पछाडि एज एन एम्ब्रोलोजिस्टले एउटा ल्याबमा यी सब चिजहरूसँग काम कसरी गर्छ भन्ने कुरामा चाहिँ क्लियर गर्न खोजेको। अनि अर्को एउटा चाहिँ एकदम कमनली सोधिने प्रश्न चाहिँ के छ भने डु दे गेट काइन्ड अफ मिक्स काम गर्ने बेलामा यताउता अरू कसैको चाहिँ मिक्सअप भएर आफ्नो बेबी चाहिँ कता डिफ्रेन्ट हुन्छ कि साटिन्छ कि?
very big dilemma. Nothing is happen like this because it's
काम गर्ने प्रोसेसलाई थोरै बुझाइदिनुहोस् न, त्यो कसरी चाहिँ गर्नुहुन्छ?
Like I'll give you the option. I'll give you the example. Sorry. In our hospital today there is a 3 OPU. Okay, 3 OPU means we are retrieving oocytes and we have to done the ICSI.
Okay.
And I take the sperms. I told the patient's husband that just collect the semen. So firstly what I have to do, there is a container. I'll label the name of the patient, wife name, husband name, their age, and the hospital generate a particular ID for a particular patient.
Okay.
So I have to write it down that also on that, and on the lid of that container I also write the same ID, the name, the age. That's the first step to cure, like to not to just mishappening anything.
Basically त्यसको नि एड्रेस लेखिन्छ भने जस्तै।
Yeah, this is the first step. And the second step now during processing of sperms. The processing basically we separate a good sperm from semen. So after that we will able to do any conventional IVF or ICSI. During that process, preparation of sperms, there is a tubes, there is long tubes that we used, and everything we will label on that tubes. With the this is one patient 1, this is patient B, this is patient C. Everything I will label on that, and after that centrifugation I will separately use that's a dropper we use or kind of के भन्छ
अब हाम्रो यो सेन्टरमा त हजारौँ यस्तो चाहिँ एम्ब्रियो र अनि त्यस पछाडि स्पर्महरू चाहिँ फ्रिज गरेर राखिएको छ नि त। यो मध्ये चाहिँ तपाईँलाई ठ्याक्कै त्यही पेसेन्टकै हो भनेर चाहिँ हाउ डु यु म्यानेज टु गो थ्रु द्याट यत्रो धेरै डाटा?
It's everything done. Like this is what I'm telling you. This is how we do A, B, C procedure, and that sperms will be out from the lab. Like I'm doing ICSI for patient A. I will bring only patient A sperms inside the lab. I will not bring the other sperms inside the lab. I will take only patient A sperms inside the lab. I will do ICSI, and after that I will discard it. Then I will bring the other patient's sperms inside the lab.
एउटा पेशेन्टको काम एकचोटिमा मात्रै
for at a one time so I'll do work with only one sperms.
Okay, to lab भित्र अर्को कुनै
this is the third layer of protection, and the fourth layer is the double witnessing. The junior which is working with me, she will also help me to verify this is patient A, this is patient B, this is patient C. So there will no be any misunderstanding or kind of that. So there is I think zero chances with that mixing of sperms. Zero chances.
Okay.
There are 4-5 layers of protections that we should do.
ल आजको नेक्स्ट क्वेसन चाहिँ के छ भने स्पर्म क्रायोप्रिजर्भेसन. अब स्पर्मको क्रायोप्रिजर्भेसन नै छ प्रायः जस्तो चाहिँ हामीले एम्ब्रियोलोजिस्टको बारेमा अरू पनि कुराहरू गर्नुपर्ने थियो, तर सायद आइभिएफको प्रोसेसको बारेमा अनि त्यस पछाडि उसको बारेमा. तर आज हामी चाहिँ जस्ट फर्टिलिटी प्रिजर्भेसनको बारेमा चाहिँ कुरा गर्ने भइदिएको भएर जस्ट स्पर्मको क्रायोप्रिजर्भेसनको भनेको के हो, स्पर्मको प्रिजर्भेसन कसरी हुन्छ, अनि सहारामा यसको स्ट्यान्डर्ड कस्तो छ, अनि हाउ रिलायबल इट इज, पेसेन्टहरूले चाहिँ यो कुरालाई चाहिँ एकदम इजी तरिकाले ओके. किनभने स्पर्मको फ्रिज गरेर राख्न कति मेल पेसेन्टहरूले मान्दैन. भनौँ न किन मान्दैन भने आई डोन्ट नो, त्यो मेरो स्पर्म राखेर त्यहाँनिर चाहिँ अर्को कुनै केही प्रब्लम भइदियो, अर्कैमा गयो भने फेरि मलाई केही प्रब्लम आउँछ कि पछाडि एउटा त्यो. अनि अर्को भनेको चाहिँ इफ मैले चाहिँ नेक्स्ट टाइम फेरि दिन सक्छु स्पर्म भने भाइ अहिलेदेखि चाहिँ फ्रिज गरेर राख्नु. अनि यो कुराहरू चाहिँ पेसेन्टले सायद अलिकति नबुझेर हो कि होइन. अब हामीसँग हुन त यहाँ हजारौँ त्यस्ता चाहिँ पुरानो उसहरू त होलान् होइन, तैपनि अहिले आउने इभन नयाँ पेसेन्टहरूमा पनि कन्सेप्ट चाहिँ कस्तो छ भने स्पर्म सकेसम्म फ्रिज गर्नु नपरे हुन्थ्यो. डाक्टर साहबले चाहिँ जब उहाँको चाहिँ स्पर्म फ्रिज गर्नुपर्छ 1 वर्षको लागि भन्नुहुन्छ नि, जब जस्तै कोही पेसेन्ट आउँछ म त 2 महिना पछाडि विदेश जान्छु भन्दै आउँछ होइन. समस्या छ उसलाई होइन. अब स्पर्मको भनौँ न राम्रो मोर्टालिटी या उसहरू छैन अरे भनौँ होइन, या काउन्ट राम्रो छैन अरे. अब डाक्टर साहबले यति बेलै फ्रिजिङ गरिदिनु भने पछाडि कहीँ न कहीँ चाहिँ त्यो पेसेन्टलाई त फाइदा हुन्थ्यो होला. जसले गर्दाखेरि
basically the protocol said that if you are doing any case, the first priority is to freeze the semen in any kind, if the patient is able to give semen on the day of OPU or not.
Okay.
But our first priority to freeze the semen. The reason is, first reason is basically if the patient want to go abroad or kind of that, that's the reason that we have to freeze that embryo, freeze that semen, because he will not be able to come. That's the first reason. Other thing is on the day of OPU, if he is not able to give the semen, like we retrieve the oocytes, we can put inside the incubator for there is a IVM process, in vitro maturation. For that we have to put inside that for 2 hours, and after that we have to do ICSI. We cannot put that oocytes inside the incubator for whole day. That will start degenerating. Okay. The second reason is if he's not able to give the semen on the day of OPU, on the day of ICSI, on the day of conventional IVF. So in that case, we can use that frozen sample that we already freezed before. Yes, previously we have freezed. And the third reason, if same on the day of OPU, he might have get some work, he has to go in case of emergency. In that case, we can freeze that semen. And the third case is to preserve the infertility. Fourth case, like 6 months before, patient have done their semen checkup.
Okay.
The sperms was good. There was a 40 million count and a 60% mortality. And after 5 months, he might have taken a lot of drinks, he have done a lot of drinks and smoking, or kind of exposure to high temperature. Then like the Gulf country, a lot of I think Nepalis go there and work. And in that cases, I have seen that the sperms are very low, the count is very low, mortality is low. In that case, to preserve that, so
मेलको फर्टिलिटी डिग्रेड हुनको लागि चाहिँ टाइम लाग्दैन कि के हुन्छ र
it can be done instantly, it can be done within month or 2 months, or it could take a lot of years. That basically it's depend upon patient to patient health. And that's what I'm telling, that in this case, like 5 months he will done the semen analysis, it was normal, and after 5 months he will done, the count is very less than 10 million.
2-3 महिनामै त्यस्तो नि हुन्छ
हुन्छ, no, there is no issue, it can happen. And in that case we have to preserve that semen to not to, like, he's moving towards azoospermia. Azoospermia is a condition when there is no sperms inside the semen, so he's moving towards that. So to preserve that, we can freeze that sample, we can freeze that sperms, and after that we can use it by doing ICSI. So that's also basically the infertility preservation for the men.
ओके, अब आयो कुरा फिमेलको चाहिँ एगको क्रायोप्रिजर्भेसनको कुरा। जस्तै पहिला कुरा त फिमेलमा महिनामा जम्मा एउटा अन्डा आउँछ, अनि इफ एउटा मात्रै अन्डा आउँछ भने हाउ डु वी गेट त्यो 9-10वटा अन्डा होइन, त्यो उसको लागि। अनि यो अन्डाको उसको लागि चाहिँ हामी पहिला ओपियूबाट सुरु गरौँ होइन। ओपियूबाट सुरु गरेर लिएर जाँदाखेरि फिमेलको चाहिँ अब जब ओपियूको प्रोसेस भनेको अन्डा जिक्ने प्रोसेस भयो, यो प्रोसेसमा चाहिँ हामीले नर्मल्ली सहारा इन्टरनेसनल फर्टिलिटी सेन्टरमा चाहिँ 10देखि 15वटा अन्डा देखियो भने लगभग 10वटा अन्डा निकाल्न सक्ने हाम्रो यहाँको चाहिँ टेक्नोलोजी छ होइन।
It is depend upon patient to patient. 10 to 15 is depend upon the patient, I'm telling you. Okay. If the AMH is low, if the AFC's count is very low, how we will able to get a 10 to 15? Or the other thing is depend upon the age of the patient. If the patient is 35 plus, there is a higher chances that we will get only few oocytes. If the patient is PCOS, we will able to get 40 plus 40x.
40x?
Oh.
And then the quality will be very low.
Quality compromise. It's a very simple process. We'll start the stimulation, ovarian stimulation basically. We'll start from the day 2 of menstruation cycle. First on the day 2 we'll see the AFC, it's androfollicle count in the ovaries, how many numbers of follicles in both ovaries. Okay, according to that we'll start with the lower dose of hormones. We'll start with 150 IU. Some patients will start with 75, and after 5 to 6 days of stimulation, after we do scan, we check the size of the follicles, and if the size is very low, like there are a lot of patients have a poor responder, and some of the patients are very good responder to the hormones. Lower responder means we are giving a dose of 150, but the size of the follicles are growing very slow. That's a lower responder. And basically on the day of 5 or 6 day of stimulation, we'll check the size of the follicles, and after that we change the dose. If it required a more dose, we'll add 200, 250, 300, kind of that. And after that we start the injection also, which is basically help the follicles not to rupture. We'll start also that injections after 5 to 6 days of stimulation, and it extend up to day 10, 11, 12, which depend upon the patient. And when the follicles, if in a right ovary there is a 4-5 follicles which are having a size of 18 to 20 mm, and on the left side same 18 to 25, 6, and we decided to do giving them the trigger. And what is trigger now? The main part of the trigger is to mature the oocytes. There is a category of oocytes, I will tell you later. To mature the oocyte, we'll give that trigger injection, and after giving the trigger injection, within the 34 to 36 hours after that trigger, we have to do OPU. We have to retrieve the oocytes. If we are not going to do that, it might rupture inside the body. Follicles might start having rupture inside the body, or the quality will compromise. So that is the exact window from 34 to 36 hours post trigger. Okay, and on that time we have to retrieve the oocytes, and after retrieving oocytes there is a different procedure start in the lab. Like we have to freeze it, whether we have to do ICSI or whether we have to do IVF.
After all this process, then after comes के अरे यो अहिलेको क्रायोप्रिजर्भेसन या एगको चाहिँ प्रिजर्भेसनको बल्ल आउने भयो होइन. अब यत्रो लामो प्रोसेस पछाडि बल्ल चाहिँ हाम्रो एगको उसमा चाहिँ आइएछ होइन. अब यो सुरुमै हामीले चाहिँ अन्डा कसरी आयो भन्ने कुरा हुन्थ्यो कि होइन. अन्डा चाहिँ यसरी आयो भनेर नि त भन्नु पऱ्यो. अनि अन्डा चाहिँ पहिला सुरु हामीले स्टिमुलेट गरियो, ट्रिगर लगाइयो, अनि त्यस पछाडि ओपियु गरियो, अनि त्यस पछाडि वी हेभ नाउ एग्स. अब यो एगलाई चाहिँ हामीले कति लामो समयसम्म चाहिँ फ्रिज गरेर राख्न सक्छौँ या चाहिँ वाइ यो बेनिफिट्सहरू के हुन्छ यसको. अहिलेको यो जेनेरेसनलाई चाहिँ के पनि थाहा हुनु पऱ्यो भने म्यारिज एज त अलिकति बढ्दै गइरहेको छ नि त. अलिकति 30 वर्षभन्दा चाहिँ बढी भइरहेको छ. त 30 वर्ष पछाडि त फिमेलको एगहरू चाहिँ क्वालिटी घट्दै जान्छ भन्ने कुरा छ. भने पछाडि अब यो क्रायोप्रिजर्भेसनले गर्दाखेरि चाहिँ अनि यो प्रोसेसमा चाहिँ कति समय लाग्न सक्छ. यो इम्पोर्टेन्ट हुन नि सक्छ या नहुन नि सक्छ होइन. कसैलाई चाहिँ यो टेस्ट गरेर कसरी टेस्ट गरेर हेर्ने, आफ्नो अन्डाको क्वालिटी कुन एजमा गएर हेर्ने, क्रायोप्रिजर्भेसन चाहिँ कुन टाइममा चाहिँ त्यो पेसेन्टलाई चाहिँ इम्पोर्टेन्ट हुनसक्छ या आफू पहिल्यै अवेर भएर बस्न सक्छ भन्ने कुरा चाहिँ यहाँ जजले गरिदिनु पऱ्यो.
I think it is very important nowadays. Cryopreservation is very important, basically, especially for the women. The reason is that first is marriage, a delay in marriage. Basically, we are nowadays it's a very like people want to stand in their life, and after that they will think about the marriage, all the thing about the child. So it will like normally they are having a child after 28, 29, 30. As the age increase, the effect on the oocytes will be there. The quality will compromise. For that, people who want to do a late marriage, like after 30, and like if they want marriage, okay, they will done in 28, 29, but they want child.
Even
later.
If they married, they will plan their babies too late.
Too late. For that, they have option to preserve their oocytes. And after 4, 5 years, 6 years, they can go for IVF. And that in that time we'll take sperms from the husband and we'll thaw that oocytes, we'll do ICSI, we'll make embryos, we'll transfer inside the uterus. That's the simple process. The second thing is for that women which are having any health issues, kind of they are diabetic, they are having a thyroid problem, or any kind of they are not able to.
The rest of problem the अलिकति age body हुन थालिसके पछाडि
within the age it will increase, that problem will increase. And in that case
25 वर्षको उमेरमा डायबिटिजहरु त अलिक
diabetic no, some of there is a lot of patients having genetic problem in heredity. The parents have a diabetic, they have, like I am giving my example. In our genes profiling there is a diabetes. Okay. So I avoid these Gulio kind of beta. I don't. So I avoid these things. So it's in the gene. You're diabetic. It's a genetic problem. It's also a genetic problem. So in that case, we can freeze the oocytes. And the third is if the patient, if the lady have a kind of breast cancer or cervical cancer or ovarian cancer, uterus, kind of everything, and they want to go through the chemotherapy. I think it's very important in that case. They must first go for IVF. They consult with their doctor.
They don't have baby.
How they will be able to baby after that chemotherapy? They will destroy all the cells. It will affect on the ovaries.
किसी के पास already married हो, उसके पास babies हैं, तो उनको फिर यहाँ आगे OPU करने की कोई आवश्यकता तो नहीं होगी ना?
Sorry? If
लेकिन कोई किसी को कैंसर हो गया लेकिन उसका पास ऑलरेडी मैरिड थी एंड देन ऑलरेडी बेबी हो चुके थे तो उसके बाद कैंसर दिखे तो उनको तो नहीं चाहिए ना
why they don't this is for like unmarried. This is for unmarried. Chemotherapy, what we can do, first option is we can stimulate the patient, we can retrieve the oocytes, we can freeze that. Another thing, they can preserve the ovarian tissues. The second is ovarian tissues.
पूरा ovary
we'll take out the ovaries, we'll cut into pieces. There is a other procedure, we can preserve that. And after chemo, if everything is getting normal, then we can like implant that tissue inside that
does that
lady,
works?
And it will again starting grow the tissues, the cells, because there are millions of oocytes there.
वो फिर काम करता है
हाँ जी करता है. It will work. that's the technology ना.
इतना यति चाहिँ एडभान्स टेक्नोलोजी चाहिँ नेपालमा या सहारा इन्टरनेसनल छ. अरे यहीँ हुन्छ त्यो
गर्नु मिल्छ, नो इस्यु.
लौ न, मलाई थाहा थिएन यहाँ हुन्छ त्यो. त्यो काइन्ड अफ अपरेसन
the specific media that required. We can preserve over here also the ovarian tissues easily.
त्यो नाइट्रोजनमा त्यो त्यति चाहिँ लो उसमा चाहिँ -196 को चाहिँ त्यो जुन तापक्रम छ त्यसमा चाहिँ इभन त्यो मिडियाको चाहिँ खास त्यसलाई चाहिँ केही नै हुँदैन. त्यो उसमा चाहिँ माइनस त्यति उसमा पुगे पछाडि केही पनि चिज फ्रिज हुन्छ अनि के चिजले बनाउँछ.
Like I'm telling you, this is media, this is oocyte. Oocyte is basically, they have a lot of water inside that. There's a hypertonic solution. Hypertonic will put that oocyte inside the hypertonic solution. The water comes out.
त्यो मिडिया चाहिँ कति -डिग्री सेल्सियसमा गइसके पछाडि चाहिँ त्यो पनि फ्रिज हुन्छ होला कि फ्रिज हुँदै नहुने चिजहरु त्यो.
Just listen to me what I'm going to tell you.
Media
we preserve basically what we preserve. What we used to preserve, we preserving not to having ice crystal formation. चीसो है ना, चीसो में तो obviously there is the formation of ice. If you put water inside the nitrogen, it will convert into ice. हो यस्तै हो.
मैले देखेको फ्रिजिङ त यही नै हो.
To preserve that ice crystal formation, we use the specific media. What that media done? That media pull out all the water from the oocyte.
Okay.
Only water content. The media will go inside that oocyte. It will preserve all the organelles.
Okay.
Organelles kind of, this is house, this is your room. There is a mic, there is this laptop, computer, everything. These are organelles of this body. So that preserve all the bodies inside the oocyte.
Basically यहाँ के इस रूम से हवा निकाल दिया and then
हवा निकाल दिया, we remove the air
and then we
preserved everything like bacteria, we preserved from bacteria. Okay. This is we preserve that ice formation.
Okay.
And this is how we can freeze it for a long time, 5 year, 10 year, 15 year, 20 year, and during warm up we putting back into normal. That we use a different specific media.
Okay.
It regain their shape, oocyte regain their shape, embryos regain their shape, formation, everything start working normally. The metabolism start normally. This is the vitrification.
सर्फेसमा मात्र बुझिरहेको छु यो मैले चाहिँ. अब त्यहाँ हुन्छ होला नि त कति पर्सेन्टेज चाहिँ वाटर त्यो उसमा हुन्छ होला होइन, बाँकी रहन्छ होला, या कति चाहिँ उसहरूमा चाहिँ त्यो हुन्छ तपाईँको गेज त छुट्टै हुन्छ. तर त्यसको लागि चाहिँ अब हाम्रो ल्याबको चाहिँ कन्डिसन कस्तो उसहरू कस्तो त्यो कतिको चाहिँ एडभान्स छ अनि कतिको राम्रो चाहिँ इभन त्यो फ्रिजिङमै पनि त अब त्यसको पनि त फ्रिजिङको पनि प्रोसेसको क्वालिटी होला काम गर्ने होइन, त्यो टेक्नोलोजीको चाहिँ उसो होला. हाम्रो सहारा इन्टरनेसनल फर्टिलिटी सेन्टरमा चाहिँ यो टेक्नोलोजी चाहिँ कतिको राम्रो छ फेरि अरू
टेक्नोलोजी. लाइक वी हेभ अ गुड ल्याब, भेरी गुड ल्याब. And the second thing, the most important thing I'm going to tell you, the most important thing is the handling of the embryologist. It's very important. if the embryologist is not experienced, it only he's or she is a junior embryologist, he's just started his job, it's been only 1 year, so there is a like freezing is a very critical, the vitrification process is a very like critical procedure. It's we have to very take care while doing handling, because there is a two type of, like giving you example, there are two type of media. One, there is equilibrium media, we put inside oocytes or embryo for 10 to 15 minutes, and there is one is a vitrification media. In that vitrification media, we just have to expose oocytes or embryos only for 1 minute. Exceeding more than 1 minute, 1.5, it will affect on the quality of embryos or oocytes. Yeah, that's a crucial part. We have to done it within the 1 minute. So it's totally depend upon the handling of the embryologist. And the other thing is the quality of media also depend upon it. If the quality of media is not good, it's expired media that we are using, or other thing is the lab quality is not good. There is a air quality is not good of the lab. There is a fungus, there is a like bacterial growth inside the lab, that will also affect the quality of oocytes or embryos. That's the three things.
Okay, I think we have done everything today. Sperm, testicular, embryo भी हो चुका, ovarian भी हो चुका शायद, ovarian
mostly cryopreservation done है हमारा. हाँ, cryopreservation part तो done ही है. Any questions if you have in mind, वो write down कर ले and we'll do it again.
अब त्यो ART को चाहिँ उसहरू छ,
ART को
ART भनेर IVF